Common catfish diseases and treatment. Brown blood disease. Nitrite poisoning, commonly called brown blood disease, is an environmental condition that affects a number of fish species cultured for food today, including channel catfish. It's caused by elevated levels of nitrite in the pond or culture system water. Nitrite, a product of the breakdown of ammonia by bacteria, is a compound that can enter the circulatory system of fish through the gills. Its presence at elevated levels can cause the fish blood to take on a dark brownish color, thus the name brown blood. The solution: using salt, NaCl, as an amendment to water. More explicitly, the chloride, Cl, which is found in common salt, is the fraction of salt that is responsible for the prevention and can affect treatment of nitrite poisoning in fish. The chloride competes with nitrite at the fish gill surface for absorption. Prevention is far more economically desirable than trying to treat fish already stressed and dying. The best management practice is to use salt conservatively. It is a prudent business practice to retain as much salt as possible by retaining as much water as practical. Most effective managers monitor chloride levels at least 2 to 3 times per month to maintain a minimum of 60 parts per million chlorides. Setting standpipe elevation to capture rainfall and reduce dilution by excessive rainfall should be a conscious goal. As a management task, pond water should be monitored for chloride levels several times each year. If a concentration ratio of 9:1 of chloride to nitrite is maintained in water, many more chloride ions are absorbed than are the nitrite molecules. Therefore, nitrite poisoning or brown blood disease does not develop. Prevention is the key and is much less expensive than correcting an existing problem. Maintain a minimum of 60 parts per million chlorides at all times in commercial catfish ponds. Always maintain at least a 9:1 chloride to nitrite ratio. Many use a 10:1 ratio.